Hey, welcome back inside the Now Morning Show. Just about 8 minutes before 7 o'clock. And, you know, like I said earlier, it's already the end of November. We're basically inside Christmas. And what you can give somebody this Christmas is the gift of movement. I want to welcome this morning directors at TheraFit Physiotherapy Clinic, Daniil Jack and Shannon John, who joined me on set this morning to chat about their annual charity drive. Good morning, ladies.
Hi, good morning.
How y'all doing this morning?
You're fine.
We're good.
All right. So last year, you had a representative. Was it the two of y'all?
Yeah.
Okay. Well, great. This is going to be fantastic then. So last year we spoke about the charity drive that y'all have at TheraFit Physiotherapy Clinic, where we want to have people with mobility to help people get better mobility. Let's get a little recap on, firstly, why was this charity started in the first place?
Okay, so we as physiotherapists, we provide mobility for patients, right? With the use of mobility aids, we help assist them to walk after injury and stuff. And in the field, we found that there was a need. Patients who had faulty mobility aids, faulty canes, and they were unable to afford new ones. So we decided, and then as therapists, we go into homes and we see patients after recovery. They would have aids that just sit there collecting dust and they're not in use. So we decided that we would collect these mobility aids and distribute them for persons who are unable to afford them.
How did the distribution go last year? How did the collection and distribution go last year?
We did do pretty well, and we were able to donate mobility aids to persons who called and asked, as well as we donated to a couple homes as well. I would say the supply was a lot less than the demand.
Right.
So, but it's a charity event that we kind of have year long, but just in during Christmas time, we push it a little more.
All right. So tell me something. And Kev, do we have any kind of numbers or estimated numbers? Like if you say supply and demand weren't matching.
Right.
We had more demand than we had supply. What kind of supply we had?
It's kind of hard to do a check right now, but there were a few patients, especially in need of wheelchairs, that we were unable to provide.
Okay.
So I think wheelchairs is like one of the main mobility aid that we're looking for with respect to donation.
I think that's a good place to go, because I was wondering, you know, which things are in more demand. Like, we mentioned canes, you mentioned
walkers.
Yeah,
but the wheelchair was most in demand. Yeah.
And is that because the wheelchair gives you the best movement in terms of getting from point A to B?
I think it's the most expensive.
Oh, it's because it's the most expensive.
Yeah, it's the most expensive.
All right. And in terms of, using the mobility aids, because even if we don't have, a wheelchair is a fairly obvious thing to use, right? But in terms of some of the other mobility aids, do you guys help with teaching people how to use them for the best use possible and that kind of thing?
Yes. So we would measure to make sure that the cane is at the right height, to make sure that the walker and crutches are at the right height so that you don't cause any undue harm, and you make sure that you're able to ambulate safely.
And is there, do these things expire? Like, I know people have, I remember growing up, there was always a pair of crutches under the bed. Like, I think somebody had broken a leg sometime and they needed crutches, and we got it, and then we just kept it there until sometime years later somebody else needed it again.
It can be reused.
Right.
Probably just the condition of it might have to repair, in terms of sometimes the rubbers underneath wear off, which could cause it to fall, because the rubbers underneath may have a suction to the floor.
Yeah.
So that might require changing. So if persons do decide to donate used stuff, we would repair them before giving to patients.
So they don't have to worry about it. People who want to give to the charity drive, they don't have to worry about it. They just need to, whatever they have, whatever condition it's in, as long as it's not broken in half.
Yes. They give it to us, and we would repair.
As long as it's functional, yes.
As long as it's functional, okay.
Yes.
And you guys will repair it.
Yeah.
People often wonder, why might I need a mobility aid in the first place? So for people who are, wondering, all right, so I have this thing, I have an extra thing here in case something happened to me, but I'm not using it, but somebody else might need it. Why are mobility aids important for people?
I would say mobility aids are important for persons who may have a disability or who have an injury. It helps reduce pressure of the joint. It helps you to walk around or move around in less pain. It helps you to function better as well.
And is it that there's a set time, or is it that it based on your injury determines how long you would have to use a mobility aid for?
Yeah, so it depends on the injury because we as physiotherapists, our goal is to make you functional.
Right.
Yeah, regardless of your injury, regardless of the disease you may have, we want to make sure that you are functionally able to work, able to go around your house and do what you need to do. So these aids would help patients do that.
You know, I'm always curious about the human body when it comes to recovering after things like injuries because, you know, we see people who might walk around with canes for years to come and because they're just constantly in pain or they don't do the physiotherapy or they can't do the physiotherapy. What happens to those patients? Like if somebody comes to you and you like can't make them better because of whatever their illness is there a way to maybe ease their pain or to get them mobile enough?
Right. So as physiotherapists, we also pain management.
Right.
With the use of what we would call modalities, we would use to help relieve the patient pain as much as possible. I would say if somebody is walking around using a mobility aid and is in pain as well, it could be as well that they're using the wrong mobility aid or they're using it wrongly. So we could probably prescribe a different mobility aid with them, something with more support so that they can move around in less pain.
Mm-hmm. Okay, and so for this Christmas drive, I know you all focus very much on the mobility aids. Do you all offer like some physiotherapy on the side when you're giving the aids?
Well, right. So we would give advice as well
Right.
to the patients, and as I said, teaching the patients how to use the aid properly as physiotherapists is extremely important. So we would be providing that service.
All right, fantastic. And you said it runs all through the year. Yeah? So is
Yeah.
there a point when it stops? Or at any point in the year we can come and give some of these
So
mobility
we
aids?
won't reject any. So once we get in them, you could bring them in. But for Christmas, we usually try to cut off, like, say the 16th of December, we're cutting off this year.
Okay.
So that we're able to distribute.
Okay. When does
Yeah.
distribution start?
So distribution starts the following week.
Yeah.
We would advise persons to call us if you know anyone who needs an aid.
That's what I was going to just
Yeah.
my next question is how do we determine who is in the most need? How do we determine who gets these aids?
Well, it would be based on who calls and, well, who calls first as well. And
But is there like an assessment?
well, yeah, so we would ask the patient specific questions with respect to their mobility and determine which would be suited best for them. If they are able to come into clinic as well, we would be able to do like a quick assessment to know which mobility aid would suit them best.
All right. Where is Therafit Physiotherapy Clinic?
So we have 2 locations. We are located on Guanapo Street in Arima, and then our other location is at Montrose, in Montrose, Shogunas.
Okay. And people can just walk in or you have to call and book an appointment? How does it work?
We would prefer if you call first. Just come in.
I
So we
like how you're
prefer,
politically correct with it. We would prefer. Don't just come. We would prefer.
if you call first so that we get a heads up so we're able to, put things in place so when you get there, we'll be able to assist you as best as possible.
And you'll see all types of patients with any type of injuries, any
Yes,
type of...
from children straight up to the elderly.
All right, fantastic. Is there a way to contact you all to get that to book the appointment?
Yeah, our contact number is 316-1978 and 322-5367.
All right. And any social media, anything like that we can go check out?
Yes, we are on Facebook and Instagram, Therafit Physio, and we also have a website as well, www.therafitphysio.com.
Therafitphysio.com. Ladies, thank you so much for the work that you continue to do for people who need these mobility aids. And I know it's going to be a great time. I hope that we're able to get more supply than demand this time.
Yes.
Yeah.
Hopefully. But of course, if you have a mobility aid that you're not using, that you may just have around the house and you're cleaning up for Christmas, you can send it across to Therafit Physiotherapy Clinic because they're definitely going to give it to somebody who needs it. Thank you very much, Shannon John. Thank you very much, Janelle Jack. Please enjoy the rest of your day.
Thanks.
Thank you.
All right, we take a quick break. When we come back, we take your phone calls. We also celebrate some birthdays. So stick around. It's the Now Morning Show. Stay tuned.